have a bad partner, they can pack the bags themselves. They only need snacks to keep them and their energy up. Hi guys, welcome back to my YouTube channel. If you're new, welcome. I'm Nina, the simple Kenyan girl. So I have had lots and lots of requests about what to carry in your hospital bag. That's you and baby and maybe partner, and then what you need for your postpartum, like what you really need. So if you don't know, currently I am expecting my second child, and this is I packed all this by the week I got 34 weeks into my pregnancy. So I've been wanting to film this, but I've been tired over the weeks. But today we are 37 weeks and I am ready to show you what I have packed in my bags. And by bags I mean baby's bag is aside, my bag aside. Partner just can come with the snacks, or your birth support can just come in with snacks and their mental state just to be okay, so that they don't stress you up while you're in labor. Okay, I'm gonna start with mommy's bag. So in mommy's bag we have this, first things first, pants. So these are disposable pants that you can put on with your maternity diapers. So I'm going to use this just because this is what I used in my first pregnancy, and they don't have any fragrance. They are very good and they are big enough. So, and it depends on your flow too, if you know your flow. Yeah, if you've had your first child and you've seen your flow, I think it's a very good idea to know what to expect. Should I get more of this or less? Yeah, so this is my go-to, and some pants. So why am I using these pants rather than my regular pants? So most of my regular pants, they are good cotton pants, so I don't want to mess that up. And another thing, these are disposable, so it's a lifesaver. I don't have to be worried about leaking, and if that's gonna be cleaned up, and how I'm gonna wash it, and how I'm gonna get it off. Yeah, and all my dark pants, but by dark I mean like black and all those dull colors, they can't fit. So I am certain, because I am sure when I just give birth I won't bounce back immediately, so they won't fit still. So why stress myself? Yeah, so this is how they look. Yeah, they might look big, but they're actually not. Yeah, so that is how they look. And for my case, I'm gonna carry these 4, just because I am certain I won't stay in the hospital for more than 4 days. Or yeah, because now there's COVID, so everything is a little bit changed up. So with my first child, I stayed in the hospital for a day. After I gave birth, the next day I was sent home. But currently I'm seeing a different protocol. You give birth like in the morning, and by evening you're being discharged if your BP and everything is okay. So yeah, let's wait, we'll see. Another thing that it's a must have, for me especially because I drink lots of water, is a lip gloss, because my lips break a lot. And this is because I'm practicing hypnobirthing. It's a topic that we'll talk about. So it's all about breathing techniques. So breathing out, your lips really dry up, and messes up your face sometimes. Yeah. So another thing is just a simple bra. This, I wouldn't recommend a sports bra. Maybe if you're not sure of how long you're gonna stay in labor. By not being sure, I mean if you're a first-time mom and you just want to feel like everything is in together. But I'll tell you this: you do not need a thing when you're in labor. You don't need pants, you don't need bra, you just need your gown, your maternity gown, to work the labor through. So this is I'm gonna get two bras. So one after I give birth, and then I take a shower. I'm gonna put that on, and then just breastfeed and stuff. So this is a nursing bra, so it helps with breastfeeding. And after that, I'm gonna change into, when I'm dismissed, another bra. So there's no need to carry lots of bras. Two is enough. If you've scheduled a c-section, which I think you stay in the hospital for 5 days, I think 3 bras are enough. Come on, 3 is okay. Yeah. Another thing, ladies, don't forget your purse. Don't forget your purse. You need your cards, you need your ID, you need your insurance card, you need them packed. You need literally your cards, your ATM card. You might want to get something on your way, or in some coins. Yeah, they're good, they can help. So I'm gonna put that in. So I'm gonna put some earphones in, just because I am practicing hypnobirthing, and when labor comes, I need someone to guide me through the breathing techniques. So that's why I need this. But if you can get some headphones, I'm not sure, by that time probably I'll get some headphones, I don't know. But yeah, it's essential. So I'm just gonna pop that into so one thing, ladies, in the hospital they provide you with toothbrush, toothpaste, a small toothpaste, what else, a basin, some sandals, and soap. So you don't need to carry toiletries. But if you want to carry toiletries, be my guest, go ahead and carry that. But I personally don't want to have lots of things to carry, so I'm not gonna carry that at all. So I'm just gonna go, because I'll pay for it. So why not use them? So the only thing I need to pack as a mom is just what I'll need to use, maybe the maternity diapers, I mean pads. I don't like diapers because it's smoking hot after bath. So They provide you with pads too, but they might not last as long, just depending on your bleeding. So these are just in case pads, but I have pads at home for continuation. Yeah, so I'm just gonna carry a blouse that can be able to manage the breastfeeding part, and these leggings. These leggings are awesome. These leggings are like a lifesaver. They help balance your pelvic bones. So my pregnancy started showing quite early, when I was a month old. So right now I'll show you when we're done with the hospital bag check. It's really huge and very uncomfortable. So I'm sure when I give birth it won't just pop back, so I'll need something to hold it so that I just don't feel the emptiness. It feels so empty after the baby is born. You feel like there's nothing there anymore, there's no one kicking, it's just emptiness. And it gets sometimes dark, the bump itself. Yeah, so I'm gonna carry this. This helps me manage my pelvic area. So depending, if I feel I need something to really tighten me up, I'm gonna use this and then put this on. So because I don't want my tummy to, I just don't want to let it not do anything about it after. So I'm just gonna make sure I do everything I can just for the fat in the uterus to come back in quickly and hold everything together again. Yeah, but we're not here to discuss that. And a handkerchief just in case. Yeah. Another thing, don't forget your book. Your maternity book is very important, because when you get in, that's what they look to see how long you've been with your pregnancy, if you've had any problems, and how they can help when you're in labor and all that stuff. And since I went to my last clinic just in the middle of the week, so I got some blood tests done. So this is what I'm gonna go with, the blood test and the last ultrasound, so that they can just confirm everything. And yeah, so that will be it for mommy. So this is good enough for me. Thank you very much. So what's next? Baby. So baby, another thing you should really confirm when you get to your 30 weeks, or you just want to pack your bag, it's best to pack your bag by week 36 if you're a first-time mom. If you're a second-time mom, as early as 34 is recommended. It's not a must, but it's good to do it. So it's good to ask what you just ask your healthcare providers. With my first one, everything was sorted out. By everything I mean the hospital gave me clothes for the baby. I needed just to pack the going home outfit, that's it. But this time around, the hospital I'm going, they don't give anything for the baby. Literally nothing. They only care for the mother. So the baby, you have to carry your clothes, your diapers, your lotion, your oils, everything. That's on you, mama. So sort yourself out. So to be clear, it's good to really ask so that you know what you're supposed to pack and what you're not supposed to pack, because you might carry a whole suitcase and you don't need nothing in there, or you might carry a really small luggage and you've not carried anything that you need. Yeah, hope you get my point. I hope that makes sense. Yeah, so for this baby, I just carried three swaddlers. So we have, this is just a longer one, and so these are just full-on outfits from head to toe. Another swaddler, these are shorter ones so that I can just wrap the baby in there. And then the third swaddler, yeah, to wrap the baby in there. So another thing, I just got some really cute socks. Yeah. Mittens too. Two mittens, two Marvins. Yeah, as you can tell, they are just so cute. Yeah. Two, and then we have bodysuits. So smells amazing. I've been washing and nesting and nesting. Just want this baby out. And then another one. This is bigger, but just to keep the tummy, because of the umbilical cord, you need to put it in just when they start doing the poo-poo. It's messy, and I don't know if it's because I was a first-time mom. It was so hard to wipe, so I messed up the other outfits that he had on, but either way, we got through it. So don't worry, it's okay to mess up. Yeah. So actually, I'm supposed to pack 3 outfits from head to toe. That is bodysuits, some socks, mitten, a Marvin, and no, not end, a onesie, and a swaddler. And on top of that, of course, a baby shawl, just because it's quite, the weather in Nairobi has been crazy the past 3 months, so it's very chilly. Sometimes it's too hot, so these are just in case. If it's too hot, you can never be too warm with a newborn, because they've just been out of your body, which is super hot or warm, and they're coming into this world for the first time. They need to be really comfortable and feel at home. Yeah, so you get the idea. 3. So you might ask, why do I not do vests? Because they have lots of reflexes, and it's really hard to put them in just not only a bodysuit but in a vest. So they put their hands so tight, and it's so hard. But the best part is just be patient. There are lots of techniques actually on how you can release that hand if it's too tight. Yeah, so first things first, make sure if you're changing the baby, make sure he or she has a diaper on, a Marvin on, and some socks on. And then just a swaddler underneath to cover everything up if he's too tight or she's too tight to do anything, because you don't want to break those bones. Yeah. And some diapers. I've not gotten any diapers yet. I've not gotten any diapers yet. Yeah, so that's practically it. Here in Kenya, not they don't allow anyone in the bath, in the labor room. Yeah, that's the word. The labor room. They don't allow anyone, so that makes it a little impossible to just think of packing a bag for the bad partner. But if you have a bad partner, they can pack the bags themselves. They only need snacks to keep them and their energy up. So when that baby comes, they help you carry the baby, and just as you go take a shower, brush your teeth, and just refresh, because labor is work. So just need to relax after and eat and just chill. Yeah, so that is it for today. I hope you've learned something new. I hope this video was helpful. One thing I can tell you not to stress about is things like the medication for the eyes, the medication for the umbilical cord. They give you that because you definitely pay for it. If you've not paid for it in cash, you've paid for it via your insurance. So yeah, before I forget, promise to show you my 37th week bump. Actually 36 weeks 6 days, so it's almost 37. Just trying to get these things going. Okay. Yup, that's it. That's it. I will see you on the next video. I'm gonna show you what you need for your postpartum. Yeah, so stay tuned. Bye bye.